Hurt your back doing BJJ? Here are the 5 most important first steps to take if you've suffered a back injury. So obviously my passion project is this channel, Matside Maintenance, giving physiotherapy advice to BJJ players. But clinically speaking, my area of specialism is back pain. I work at a spinal clinic and I spend 70-80% of my day working clinically, looking at people with pretty severe back issues. So most of you will know that back pain is really common in the general population and even more common in people who do BJJ. Unfortunately, there's quite a lot of bad advice circulating around out there about what to do, particularly in the early first stages of the injury. And in my experience, poor management of an injury at the very start of it, particularly a back injury, can be a key indicator on whether or not the issue is going to go away or whether it's going to become a chronic, long-term, more debilitating issue. So I wanted to use this video to share my best advice on what to do in the first stages if you've suffered a back injury. The first piece of advice is don't panic. Now, back pain can be extremely painful and it sort of holds a unique place among musculoskeletal injuries. You know, a back injury can really mess up your life or fuck up your life in a way that other injuries don't tend to. You know, if you have an elbow injury or a shoulder injury, you can normally work around it in your day-to-day life, whereas a back injury will get to the core of everything you do. It also tends to be uniquely painful. And I've had patients in my clinic, women who have had 3 or 4 children, natural births, who say that their back pain is worse than the pain of childbirth. So it really is a uniquely painful experience. Because of those high levels of pain, people often respond with immediate catastrophizing, worrying, and fear. And we know conclusively that this usually makes things much worse. It increases muscular tension and can turn up the dials on pain sensitivity. So my first piece of advice is don't panic. Ignore the horror stories and certainly don't start Googling your symptoms. If appropriate steps are taken, most back pain can be managed very effectively. My second best piece of advice is avoid complete rest. And this is really the golden rule with back pain. You want as much movement as you can tolerate to help get rid of that pain more quickly. It's very clear in the research that this is the best way forward. So better than any treatments, massage, acupuncture, getting clicked or popped or cracked or cupping or whatever it is movement that is key. What do I mean by as much as you can tolerate? Well, movement doesn't need to be completely pain-free to be valuable. And sometimes in the early acute stage of back pain, all movement will be somewhat painful. If you can think of your pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you could possibly imagine, something in the area of about 2 to 3 out of 10 is the ideal zone for that gentle, easy movement to help you overcome your back pain. This is an amount of discomfort or pain that most people would describe as tolerable discomfort. You want to move as much as possible in this tolerable discomfort range, 2 to 3 out of 10. Now you might ask, what about all those treatments I mentioned earlier, massage and acupuncture and things like that? Some of these treatments I offer myself at my clinic. They all have a place if they help to facilitate your moving. So the treatment itself will only have a very temporary and transient benefit. The real value is in if the treatment helps you to move more freely and with less pain. Point number 3, if it feels good, it probably is. Of course, this doesn't apply to all aspects of life. I hear heroin feels pretty good too, but it's probably not very good for your body. But in terms of your back pain, in terms of musculoskeletal issues, if it feels good, it probably is. On the flip side, and importantly for the mentality of many people who do BJJ, if it doesn't feel good, it probably isn't. So in the acute phases, the early stages of back pain, don't push things to try and make it better. You can encourage recovery, but you can't force it. So with any movement or exercise or training modality or stretch or whatever it is, stick with the parameters I just outlined earlier, that tolerable discomfort, about a 2 or 3 out of 10. Let that be your guide rather than any sort of arbitrary stretch or movement that someone else may have recommended to you. The fourth piece of advice, control the pain. So if you are at a level of pain that's having a really negative impact on your life, talk to your GP, talk to your doctor about appropriate pain relief options. Of course, it's a common and understandable concern to not want to mask the pain too much, and of course, we don't want to become reliant on medications. However, it's important to get your pain under control for 3 main reasons. So firstly, as a physio, I want your pain under control so you can begin rehabbing your injury as quickly as possible. So if you're in too much pain, your movement will be extremely limited, and also treatment options that a physiotherapist or an osteopath or someone like myself can do to you will also be limited if you are too irritable. So getting that pain under control can be the essential first step in snowballing your rehab and your recovery. Secondly, and really importantly, if your pain is interfering with your sleep, pain relief options are extremely valuable, and I would even say essential. It's really when people have pain that stops them from sleeping properly that we can really see this downward spiral of an injury process. So people have pain, which means they can't sleep. This increases their stress and worry, which further increases the pain and makes sleep even worse, and so on and so forth. In these cases of this downward spiral, you really need to break that pain cycle with appropriate pain relief. Finally, and circling back to point 1, don't panic. If you get your pain under control, you are far less likely to catastrophize and worry about your injury, reducing the potential negative consequences of those factors. Obviously, medications need to be respected and taken seriously, but we don't live in the 14th century. We have these extremely valuable and useful tools, and I would recommend you use them. Final point, number 5, seek help if needed. So I would recommend seeking individualized help and care under the following circumstances, and I can really think of about 4 that apply. So firstly, if you are someone who tends to worry or catastrophize or panic about an injury, as we've already learned, these things can actually worsen the injury process. So if you are someone who tends to become overly anxious about this type of thing, you don't need to suffer in silence. There are people out there, like myself, who can help. Secondly, and importantly, if you've had pain that's lasted for more than about 3 or 4 days without showing significant sign of improvement, I would recommend you seek some individualized care and advice. This is because the most basic back injuries, little strains and tweaks and things like that, will normally start to heal within this amount of time. So if you've got something that's lingering a little bit longer, it might be a sign that there's something a little bit more significant going on that should be looked at professionally. Thirdly, if you've had recurrent episodes of back pain, and by that I would mean 3 or more similar episodes, it's probably a good idea to have things looked at. It's very unlikely if you've had back pain last year, and then 6 months ago, and then now this week. It's highly unlikely that those incidences are separate, unrelated injuries. There's probably some sort of injury process here that if you address it, you will stop things from becoming worse and becoming chronic. And finally, number 4, if you have some sort of higher level athletic or sporting goals. So, if you have a goal to run a marathon or enter a powerlifting competition, or maybe you have a BJJ competition coming up, the greater the challenge or stress we place on our back, the more it needs to be functioning at its best. So if you've got a heavy bout of training coming up or a competition or something like that, and you're suffering with a back injury, my recommendation for best results is to have it looked at to make sure there's nothing significant going on. So there you have it. Don't panic, avoid complete rest. If it feels good, it probably is. Manage or control the pain and seek help if needed. Back pain in Jiu-Jitsu is common, but it doesn't have to ruin your training. If you take the appropriate first steps in managing the injury and not just bury your head in the sand and hope it will get better. You will give yourself the best possible chance of making a full and complete recovery. I hope you found that information useful. If you need any specific advice on managing your back pain, you can get in touch at matsidemaintenance@gmail.com, and I'd be happy to offer you some individualized help and advice. If you enjoyed the video, please give it a like and consider subscribing to Matside Maintenance for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to help you train harder for longer and, importantly, as pain-free as possible.